Good afternoon, everyone, and thank you for joining us. I'm Matt Slavosky. I'm a press secretary to Congressman Matt Cartwright. Today, we're going to hear from Congressman Cartwright, as well as U.S. Representatives Susan Wiles, Josh Gottheimer, and Anthony Brindisi on what they will all be fighting for as the next coronavirus relief package comes together. Before we get started, I'll just take a moment to ensure our guests in the media have a recording permission for those pulling clips for TV. To make sure I don't miss you, please use the hand raise feature now. I'll make sure, I know a couple people who will be looking for that, but just to make sure I don't miss you. Okay. All right, does anybody not have recording permission that wants it currently? Okay, I think we are all set here. Lastly, before I turn it over to Congressman Cartwright, just to make, while
Wait,
I think
Matthew,
yes.
Phil Andrews is waving to you.
Oh, okay, here we go. Sorry about that. Okay.
And I got the same note for but David Wildstein is asking for permission.
Sorry, everybody. Okay, I didn't see the hand raised. My apologies. Okay, I think we have everybody now. I'm also recording on my end as well, and we'll be sharing that at the end. Before I turn it over to the Congressman, just want to make sure everyone remains on mute so the people recording can pull clear sound. All right, Congressman Cartwright, go ahead.
Great, thanks, Matt, and good afternoon, everybody. Thank you particularly to Representatives Wild, Gottheimer, and Brindisi for joining me on today's call, and thanks to the Northeast Press Corps for joining us. Here's what we're going to do. Each of us is going to say a few words, and then we're going to take your questions. As our region copes with this coronavirus pandemic, we are focused on two things: saving lives and supporting the families, workers, and small and local businesses who make our economies work. Last week, as you know, we passed our third bipartisan emergency package. In addition to replenishing the Paycheck Protection Program, this bill set aside $60 billion for smaller lenders, something we fought for to help our very small businesses, legitimate small businesses that don't have the advantage necessarily of being on speed dial with big banks. It also includes billions of dollars for our hospitals and PPE for healthcare workers. It lays the groundwork for a national testing strategy, which we all know is the key for reopening our economy in a safe manner. Still, it wasn't perfect, and a lot more needs to be done. We continue to fight every day to put families, workers, and small businesses first. The next package is something that must include funding for state and local governments so they can continue to pay frontline public sector workers like police, firefighters, teachers, EMS, and other healthcare workers. As we have had to shut down large parts of our economy to contain the spread of this deadly new virus, money coming into our state, our counties, our cities, it's only trickling in right now. And it has a big impact on people that all of us rely on. Last week, for example, we saw in Pennsylvania the unfortunate news that Luzerne County, which has been hard hit by this outbreak, had to furlough 128 county employees. That includes the Area Agency on Aging, which provides critical services for our seniors. And statewide in Pennsylvania, we're looking at nearly $3 billion in lost tax revenue at a time when people are turning to this state with unemployment benefits and nutrition assistance requests. Now more than ever, we need to ensure that our state agencies keep their staff going. Unfortunately, we could not get our Republican counterparts to agree to this funding in the last bill. We're not giving up. We're going to continue to try to persuade them. But Northeastern Democrats will continue to fight for it. We don't want our states to file for bankruptcy. There's just too much at stake for the health of our communities and the livelihoods of our frontline public service workers, our first responders. We have to attack this responsibly and in a mature manner, and that's what we mean to do. So I want to turn it over to my esteemed colleague from the Lehigh Valley, Congresswoman Susan Wild. Susan?
Thanks. Sorry, I was having a hard time unmuting. Hello, everybody. Thanks for joining us today, and thank you especially to my colleague and my neighbor to the north, Matt Cartwright, for inviting me to be on today's call. Matt and I actually share a county. Matt is fond of saying that I took some of the best parts of his district away with Pennsylvania's redistricting, and that may be true. I won't comment, but it may be true. But Matt has been one of my top collaborators as we deal with the effects of this crisis locally, and a lot of that is because of our adjacent counties, of course. And I'm thankful to have him by my side in Congress, and thankful for the platform to speak with all of you today, as well as with Josh and Anthony, who are wonderful colleagues in Congress. First and foremost, I just want to say that I have been trying very hard from the beginning not to allow coronavirus and COVID to become a partisan issue. I don't think it should be political. I think it's a health issue. I think it needs a lot of problem solving done, and that is best done by people who are working with the best interests of their constituents in mind without regard to political issues. I thought we started off on a good note in that way by passing the first few packages over on an overwhelmingly bipartisan basis. I'm a little concerned that we are veering into partisanship as we move forward. I will tell you that what motivates me the most are my conversations every single day. One of the advantages of not being in Washington is that we're able to remain in much closer contact with our constituents, albeit not in person, but by phone. But that gives me, I have countless hours every day, every week, to be on the phone with constituents, with leaders in our healthcare networks, with our small business owners, and our nonprofit directors and emergency responders, and of course with individuals who are struggling with losing paychecks and wondering how they are going to put food on the table and pay their bills. And so those conversations are what guide me as we move through this process. And I hope that on the federal level, we are going to be able to regain some of that former spirit of nonpartisanship. I'm not even going to say bipartisanship. In the last round of funding, I was very happy to advocate, along with most of my Democratic colleagues, for additional oversight of the way that the PPP loans are being granted. I've been talking to too many small business owners, as have all of my colleagues, that don't have relationships with big banks, who had trouble getting relief the first time around. My fervent hope is that with this most recent package, we are going to see a smoother and more efficient rollout, and that we are going to see additional oversight, because we cannot have people who are being shut out of this program while large corporations are taking advantage of it. And so that's a big hope for mine. I do want to say that extended funding for the community-based lenders, the small banks, I have many community banks in my district, credit unions and so forth. They've got great relationships with our smaller businesses. That was a hard-fought win for us. And it absolutely was an essential win in order for our most vulnerable businesses to be able to reopen on the other side of this pandemic. I'm also very proud of the fact that we have consistently delivered strong relief funding for our hospitals. I have two of the best hospital networks in the country in my district, and I have been on the phone with them literally every single day since this started, sometimes multiple times a day, talking to them about how they are going to continue on the other side of the pandemic, the fact that they are losing tremendous amounts of revenues because of the fact that they can't, well, they may be able to start doing elective procedures soon, but up until now have not been able to. And elective procedures, may I just remind everybody, doesn't mean cosmetic surgery. It means things like heart valve procedures and knee replacements and the kinds of things that people consider to be essential, but only under current times are they considered elective procedures. Believe it or not, that was considered a holdup. Our insistence, the Democratic caucus's insistence that we have an additional $75 billion to support our healthcare providers was considered a holdup by our colleagues on the other side of the aisle, or at least that was a talking point that was used. And I think that that was a disservice to our communities that are going to need our healthcare systems through this pandemic as well as when we get to the other side. So that was a big win in my view, and we've got to continue to advocate for the very frontline workers who are saving lives as we speak. But as Matt mentioned, a continuing concern is the lack of funding for smaller cities and municipalities. I have the city of Easton in my district, formerly Matt's district, that is really struggling right now. I've been on the phone with their public officials about their needs. My other cities, Allentown and Bethlehem, also don't meet that $500,000 citizens threshold to get direct relief, but have been a little more successful in getting relief through the state networks. And so I've just got to make sure that as we move forward, we keep these municipalities in mind. I used to be part of a city government. I know what a thin budget municipalities run on. They really, this is devastating for them. They are really struggling. And at this point in time, the funding for their first responders, their emergency personnel, who are so vital to everybody, is seriously jeopardized. I have co-led legislation called the Coronavirus Community Relief Act that would provide an additional $250 billion in funding to the smaller local governments. And of course, we can't afford to leave our smaller rural communities without direct access to support. So we've got to make sure that all of these municipalities are able to get the relief that they need. One of the other things that I've been very, very focused on throughout this is healthcare in general, not just COVID-related healthcare, but the cost of prescription drugs, the cost of healthcare overall. Just this week, I led an effort with more than 50 of my colleagues to set price caps on prescription drugs that treat the medical conditions that are most adversely affected by coronavirus, including diabetes, asthma, and heart disease. The idea behind this would simply be a cap on prescription drugs for the duration of the COVID crisis, nothing extreme, related to those particularly life-threatening diseases. For instance, the cost of insulin for diabetics. I happen to have a higher than statistically average number of diabetics in my district, and I hear from them on a very, very regular basis about their concerns before COVID and now. I'll state an obvious point. Life-saving prescription drugs are useless if people cannot afford them. And finally, I've also led some critical pieces of legislation having to do with an emergency open enrollment period throughout COVID-19. I did that with Senator Casey, so that uninsured or underinsured individuals can get themselves covered during this crisis. I was very deeply disappointed that the Trump administration not only has refused to open a special enrollment period to allow these people without coverage or with inadequate coverage to access it, but that they persist in backing a lawsuit that would rip healthcare away from millions of Americans. That seems to me to be the worst of political games, especially in regard to the healthcare of our Americans. So I think it's safe to say that this pandemic has affected the lives of every single person in my district. But what we've seen most of all is the increasing disparity between the haves and the have-nots. The haves are suffering. The have-nots are suffering even more, just as they always have, and we have got to address this disparity through this crisis and when we get on the other side. So with that, I am going to pass it to my colleague from New Jersey, Josh Gottheimer, and I thank you all for listening.
Thank you so much, Susan, and thank you, Matt, and for organizing us and bringing us all together. And Mr. Brindisi, thank you so much for your continued leadership in such a bipartisan way. I think we're all here because we're fighting for investment for our state and our county and our town governments, for our hospitals, our cops, our firefighters, our healthcare workers, and of course our businesses of all sizes and our families. We're also very focused, I know, as Susan said, on our long-term care facilities, and that's a huge issue. Our country is facing many major battles, including the fight to make sure every American is protected from the virus right now, and it's a very difficult time. We're all very grateful for those who are on the front lines helping fight, and it's up to us to make sure that we help deliver for them and for all of our families. We got to fight this together. I think the only way we've done this successfully in a bipartisan way by coming together, by putting country ahead of party, and I think it's got to continue. Every package has shown that when we actually do come together, as we have quickly, we can respond quickly, and I think our communities need it. Our frontline medical workers and EMTs need it. Our towns need it, and our police and law enforcement, our teachers. And I think it's going to be essential. And this point about making sure that we get more resources to our states in the next package, I think is critically important. If you look at, and that gets to municipalities as well, we need to lower that number, the 500,000 number, to get to our rural areas and our smaller towns. I think everyone on this call agrees that that's essential, that's part of it, something I've been fighting very hard for, and I know all of us have, and encouraging our state to push on it as well, because as New Jersey is one of the hardest hit places in the country, second most between New York and New Jersey, as Anthony can also speak to. We've got nearly half the caseloads in the entire country, and if you look at the hospital dollars that have gone out in the first package, we have less than 10% of the dollars to the hospitals. That's put a huge strain on our hospital systems, on our healthcare systems, and on our nursing homes, long-term care facilities, but also on our budgets in the state, and very worried about the hole that's been created there. I think if we come together, we can help that, as we would when we focus on any eye of the storm, any hurricane or tornado. We go to the place that's been hardest hit, like our communities, and I think that's really essential that we do that. And our states have been really stretched, whether it's purchasing PPE or helping our hospitals or our cops or our firefighters and our staff, and what's needed for our nursing home and facilities. There's huge costs that have come to our communities of all sizes. We've got to make sure that we're able to help them and get through this, or we're going to have to cut essential services like cops and firefighters, and that's unacceptable in any circumstance. And I think we've got to do it, and we can do it if we work together in a bipartisan way. We've put out co-chair a group called the Problem Solvers Caucus, and it's 25 Democrats and 25 Republicans. We have a back-to-work checklist, and doing so safely and in a healthy manner. What's key to that is that understanding that there's no one-size-fits-all approach to this, but you need certain basic things like more testing. We need to make sure to take care of our states and our municipalities, that we have the PPE for our frontline healthcare workers and our first responders, but also for our businesses to get back and going. We're going to need to have that testing. We need to make sure that our hospitals could handle if we have another outbreak, which obviously we're going to do everything to avoid, but we want to make sure that we're prepared for it. I think it's critically important that we do it. Now in Sussex and Warren County, where I also represent, Bergen County and Passaic, but Sussex and Warren, a lot of small communities, they're stretched as well, just like every other community. And so we've got to look at these things in these areas that have been hardest hit the same, and treat them treat them as we have in New York and New Jersey, making sure that we have those resources and set aside extra resources for the hot spots that have been hardest hit because of just the number and extreme caseload that's going on. And so that's going to be something that we continue to really focus on together as we look at this by region, as we look at this by sector. And the last thing, and this is a point that as a member of the President's Task Force on Reopening the Economy that we made together, that a group of us made to the President, we've got to focus on, if we want to reopen, we've got to make sure we get that testing right. We've got to make sure we take care of the areas that have been hardest hit. We've got to think about the supply chain from syringes to vaccines to making sure that we have the therapeutic treatments, and we also have, do everything we can to get that vaccine moving, but to be smart overall about how we do this. And I think as we reopen, and and today the governor announced that in New Jersey, the state parks and golf courses and other areas, recreational areas, will start to reopen, which I think is key because people want to get out, but we've got to be smart about how we do this. We've got to be safe on how we do this. And so I'll end there just to say that, it's heartbreaking to see so many people sick and to have lost so many lives of friends and family, and what's going on and not just in our hospitals, but in our nursing homes and long-term care facilities. We've got to make sure that we're prepared and that we're ready if we have another outbreak, but that we're prepared, that we're reacting now and ensuring that we're doing everything we can to help those who are sick. So with that, I'll turn it over and just thank everyone in the greatest country in the world for doing all we're gonna do. There's sun coming through the clouds now, and I know we'll get there.
Thanks, Josh. And my name is Anthony Brindisi. I'm representative from New York's 22nd District, and I'm honored to be here today with my friends, Congressman Cartwright and Gottheimer and Congresswoman Wild. And I know we all share the same goal of making sure our communities have the resources they need, not just to fight back against the COVID-19 pandemic, but also be able to make sure our communities come back even stronger than they were before. Public safety and health must be a top priority for all of us moving forward, and I'm certainly dedicated to fighting to preserve public safety and health and any future coronavirus aid legislation. Earlier this month, Senate Majority Leader Mitch McConnell indicated that he didn't want to see money go to state and local governments who have been rocked by this virus, and I think he even went as far to say it was a blue state bailout. Well, that made me think a little bit about a previous crisis that we had in New York, 9/11, and I started to think about that iconic image of George W. Bush, President George W. Bush, down at Ground Zero within days of that tragedy, and standing there on the pile of rubble and telling all the first responders about how America is going to have their back. He didn't look out on the crowd and say, we're not going to help you. Washington's going to turn our back on you because you're a blue state. No, he stood there and he said, we have your back right now. And that's the kind of leadership we need right now in Washington, because coronavirus doesn't care if you're a Republican or Democrat. It hurts us all the same. And being from New York, my home state, we've been hit the hardest. We've seen nearly 300,000 cases of coronavirus. We have by far the most deaths across the country. And what should matter now, whether you're a New Yorker or a Kentuckian, is that we're all Americans. And this is a time of need for our fellow countrymen and women, and we have to have each other's backs in our greatest time of need. I've spent a lot of time over the last couple months talking to mayors and county executives and state representatives and local government officials here in New York, and they need help. That's why I think any future coronavirus relief legislation needs to include aid for our frontline workers. This is not a blue state bailout. I would actually say that the next aid package should be a blue collar thank you to the brave men and women who have been on the front lines of this fight since day one. These are funds that will help our police officers who have kept our communities safe and continue to go to work. It's money that will help our firefighters stay on the job and who have served bravely during this time period. It's for our educators, our teachers who have continued to teach our children through distance learning. And it's for our healthcare workers who have been caring for us and our loved ones during this pandemic. We cannot say public health and safety is our number one priority and then turn our backs on the very people the men and women who have been there to serve us during this pandemic. If state and local governments across the hardest hit areas like New York are left to fend for themselves, then all of our citizens will see drastic cuts to essential services. To me, right now, that is completely unacceptable. So I'm here today with my friends from Pennsylvania and New Jersey to send a message to Washington that any new aid package must include help for our heroes. Those frontline workers, those essential workers who have kept our economy going and been on the front lines of this pandemic. So our public health, our public safety depend on it. And I want to thank again all my colleagues on the call today, and I'll turn it back over to Matt for some more words.
Matt, I think you're muted.
Sorry. Yeah, with that, we can turn to questions from members of the press.
Yes. This is Phil Andrews from New Jersey News Network. I have a question for Congressman Gottheimer. And Josh, good afternoon.
Hey, so how are you, man?
Good. You just mentioned the governor announcing he's going to reopen the parks this weekend, which I know a lot of New Jerseyans are excited about. I just want to get your thoughts on what you thought about the governor's release this week of his roadmap back to reopening the state.
Well, I certainly thought that that was a very important first step in the effort to getting to a place where where we can really reopen the state safely. There's not a one-size-fits-all approach to this, as you know, and I think the governor is dealing with many issues on many fronts, and so we've got to be very careful on how we think about this. And you're seeing part of it today with the announcement to reopen the parks, and how we do it is also very important, which the governor has also talked about. And I think as we reopen businesses, and we'll do that as well, we have to make sure that we do that in a very smart and safe way. And so I think the governor's been very thoughtful, and we spoke to him. I spoke to him yesterday about how we are continuing to deal with the outbreaks, and the numbers you're seeing continue to come out. Even though we flatten the curve, we're still seeing a lot of new cases every day, and we're still losing far too many people. I talked to him yesterday about our nursing homes, long-term care facilities, because we're working very hard to get more resources from the National Guard and from the VA into not just our veterans homes, but into our other long-term care facilities where the outbreaks have been so great, and what steps we can and must take. So I think it's a very important first step in what obviously is going to take a lot of steps to fully reopen and get back to life, at least in a modified way as we know it.
Are there any other reporters on here? Just me?
There are others, yes.
Oh, I don't want to hold. I have another question, but I don't want to hold it.
Okay, do it.
All right, just real quick. This is for you, Josh, or any of your colleagues that are on here right now. Obviously, all the governors, including Cuomo, have talked about needing more testing to even think about reopening things, and all the governors have looked to Washington for help on that. If Washington continues this theory about we're not in charge of testing, what do the states do then to fulfill those testing needs that they require to even think about opening their states?
You want me to answer from a New Jersey perspective first, then I'll turn it over to my other colleagues.
Sure.
From a New Jersey,
I'll take all of them, sure.
Okay, since you're a New Jersey guy, I'll just say that you've got to have federal leadership on the testing side of this. You can't have it, and I've said this to the president directly, you can't have it that that states are actually competing for tests. You need federal coordination. We saw the disaster of when we were competing for PPE, for face masks and gloves, and it was one state against another. I don't think that was the best approach. And obviously we were grateful for all the help from the national stockpile, but we were also having to find other resources and actually drove up prices. And you need to I think it's important to coordinate centrally on the testing side, even as each state approaches how they reopen differently, and what we do in New York and New Jersey might be different than what's done in Pennsylvania or Michigan, right? I mean, every state is going to be different depending upon what they're facing. I also think in the state of New Jersey, we have to look at it by section, by regions in New Jersey as well. It's the rural areas have got different challenges than some of the suburban or urban areas.
Thank you.
I'd just like to add in response to that question that it's ironic that at a time when we can't seem to get the Senate to consider help, assistance for our states and municipalities, that at the same time the administration is telling them that they're on their own when it comes to things like PPE and testing. So you can't have it both ways. If you're going to turn everything over to the states, the United States of America have got to support our states and local municipalities in that effort. So I would just add that how contradictory that seems to be.
Okay, thank you very much.
See Peter Haskell waving. Would you like to unmute? Go ahead.
Yeah, please. Hey, Josh, I've got a question for you. You remember?
Peter, I like the beard.
Yeah, it's the quarantine beard. Thank you. Appreciate it. You remember the Problem Solvers Caucus? You work with Republicans. You've got Democrats here. What do you hear from your Republican colleagues? And more importantly, how do you convince Republicans in the Senate that this is good for America and not just the blue states?
What in particular?
Well, what do your Republican colleagues in the House say about what you're proposing, the municipal and state aid? And how do you convince the Senate Republicans?
Well, actually, and Anthony can comment on this also, and he's a member of the Problem Solvers, but also from a New York perspective, a more rural area. Democrats, and what I've heard from Democrats and Republicans, and I'm sure Matt and Susan have heard the same, is a real desire to help out our state and municipal governments, and to lower the number, that we've got this $500,000 cap, and for certain funding streams to lower that, to allow smaller communities in more rural areas to get help as well. That's been pretty consistent. In fact, we're all working on efforts together. There's a piece of legislation I'm working on with Republican colleagues in the Senate that is bipartisan, and it's all about helping out smaller municipalities and giving more money to the states. So, I don't think what the comments from Mr. McConnell last week, I don't think that is really reflective of what a lot of Democrats and Republicans feel. And it's been my experience so far.
And I'll just add to that too. I'll tell you, I did a television town hall last night with, there were 8 members of Congress from New York, mostly the upstate region, on the television town hall. 2 of them who are Republican members of the Problem Solvers Caucus, so it was a bipartisan event. And I think, certainly, at least here in New York, I can't speak for Republicans around other parts of the state, but or other parts of the country, there's a lot of consensus that we have to do something to help our state and local governments, especially those that have been hit hardest by this pandemic. So, I think we need to make that case and really paint the picture that this is not about bailing out states who've had, issues with pensions and other problems. It's about helping our frontline workers, the people we've been asking to go to the job every day under very dangerous circumstances, and who are worried about their health and safety and the health and safety of their families. Our cops, our firefighters, our EMTs, healthcare workers. These are the folks who are really the heroes in our country right now, and that shouldn't be a partisan issue.
And my Bill Cassidy, right? Bill Cassidy in the Senate with Bob Menendez in New Jersey are leading a piece of legislation, which many of us are working on on the House side, Peter. And that's exactly all about what Anthony just said, which is about helping our local governments, about helping our states that have been hardest hit. You take care of the states. If there's a hurricane or a tornado, you take care of another natural disaster. We take care of the states that were hit. And I think there's a recognition of that a few of our states have been hit harder. We stick together, we put America first, and we get each other's backs. And you don't leave certain, states or areas out in the cold. And I think there's a recognition of that. And you don't leave cops and firefighters and teachers out in the cold, which is what will happen if we don't help out those states that have been hit.
Thank you.
Okay, I know we have a question from David Wildstein. Go ahead.
Yeah, I'm getting all the Jersey love here, guys.
Uh, Dave, are you there? You're unmuted, Dave. Okay, may have to go. David, we can come back to you if we're still not having a hard time hearing you. Is there anybody else that has any questions they'd like to raise?
Yeah, this
yeah, I do, if you don't
Basil
mind.
Nexstar.
Basil?
Yeah, sure. Hey, man. This is a question for Representative Cartwright and for Representative Wild. It's two questions. First one, I just want to know what are some of the aid that you guys are hoping you can get for those public frontline workers right now?
Sure. Basil, thanks for the question. And the answer is it's going to vary from member to member, but my own feeling is this is so vital that we support our heroes in the front line of this war. First responders, EMTs, nurses, doctors, all of the healthcare providers who, by definition, are getting up close and personal with known COVID-19 victims, exposing themselves to potential infection, not knowing when they go home at night if they're going to infect their families. And then we also have all of the essential workers, the people working in meat processing plants, people handling our groceries, transporting our groceries, stocking our groceries, shelving them, bagging them, ringing them up for us. These are people that have to be there. They're essential. The rest of us that are being told to go home and not work and get compensated for not working, these people are out there doing the job and putting themselves in harm's way. So for that reason, I introduced a bill to establish a federal pot of money within the Treasury Department to pay them hazard pay. And we suggested a certain amount up to $35,000 a year. This was something that would only go for 2020 for healthcare workers, and up to $25,000 for essential workers. That's how strongly I feel about taking care of these people who are the frontline soldiers in this war, and doing something more for them than thanking them and patting them on the back. It's hazard pay, and we have a number of co-sponsors, and I expect to get more, and I expect to get Republicans to sign on that as well. Susan?
I would just chime in that hazard pay is one of my special priorities. Matt, I hope you're right about getting Republicans to sign on to that. I'm reminded of how long it took us to get the 9/11 protections passed that Carolyn Maloney was pushing for so very long. So I hope we don't see that again in this context. And I want to see additional OSHA protections for safety in the workplace. Our meatpacking plants are a prime example of, and here they are under a presidential order to stay open without adequate OSHA protections. So those are some of my top priorities when it comes to the local situation. I also feel that it's really important that we remember the people who are desperately in need of food. We've got food banks in my district, and I know all through the country, that are really struggling to meet the demand. We've got churches rallying and just volunteers, people going out and buying the last food on the shelves and donating it to a local food bank or to a friend or somebody that they know who needs it. This doesn't sound like the United States that I've lived in for my entire life. And so food insecurity at all times, and especially during these times, is a really top priority for me.
Awesome. The last question I have for the both of you is there's been a lot of a lot of voices coming from the opposite side, from Republicans, especially from Senate Majority Leader Mitch McConnell, and also from the president. The president saying that he does not want to provide any financial support for states who had financial trouble before the pandemic. And even Senator Mitch McConnell wants a law passed that would allow states to declare bankruptcy. That obviously does not co-align with what all of you representatives are fighting for. So I want your response to the words from the president and also from Senate Majority Leader Mitch McConnell.
Yeah, I couldn't disagree more with the words of Senator McConnell. I think that inviting states to apply for bankruptcy protection is the opposite of solving problems. I totally disagree with that approach.
And I would just add that then you're creating a different stratas of citizen in this country. People from poorer states are going to be second-class citizens or third-class citizens compared to people from wealthier states. I think, I know all of you know, but it's worth pointing out that the blue states contribute more and take less from the federal government than the red states do in many cases. Mitch McConnell's own state takes far more on a percentage basis than say New York. And so it is illogical thinking, but more importantly, it really, it suggests that we are not all equal under our system of government, and that just is unacceptable to me.
Awesome. Thank you guys so much.
Time for one more question.
Yeah, if you don't mind.
Go ahead.
My name is Dominic Brown with Blue Ridge TV 13. This question, although anyone can really answer it, is kind of aimed at Mr. Cartwright and Mrs. Wild, and that is, let's just say if this funding would go through, how would these states receive that? Would it be, in a sense, would it be an application process, like a grant, or would it be kind of like how the stimulus check was, where it would just be automatically sent to them based on certain numbers, or maybe just like an equation?
If I could just take that first, Matt, if you don't mind. I haven't been terribly impressed by the way the stimulus checks, which as they're called, but they're really economic impact checks, have rolled out. I can't even keep track of how many people I've spoken to who have yet to see their $1,200 payment, and they've missed many, many paychecks at this point. So I'm not particularly a fan of rolling it out in the same way we rolled out PPP. Having said that, I do want to cut the red tape as much as possible. I made reference earlier to the fact that we need a smoother and more efficient way of getting money to those who need it, whether it's a municipality or a person. And we're just not doing a very good job of that yet. And when I say we, I'm talking about the administration, the Treasury Department, and the IRS, which have the information, the data that they need to be getting these resources out and aren't. So I do want to see much more oversight with the next round of money, and the oversight, in addition to making sure that it's spent properly, needs to be focused on making sure that it is delivered quickly and efficiently.
That's well said, and I'll chime in by adding that it's high irony, isn't it, to depend on the states to do everything at the same time telling the states to drop dead. They depend on the states to pass out unemployment compensation to a whole new class of people, self-employed, small business owners, that they can put in for unemployment compensation during the pandemic crisis. Push that off to the states. They knew very well that the states weren't set up for that. Pennsylvania, for example, never had it in the law that self-employed people could put in for unemployment compensation. So they pushed that off to the states. They expect the states to be able to handle that. they find out that the states have legacy computer programs. They had to try to find somebody in Pennsylvania who could program in COBOL language to change the unemployment compensation website. And eventually they gave up, and they had to start up an entirely new website in Pennsylvania so that it could accommodate self-employed people putting in for unemployment compensation. So pushing it off to states, I totally agree with Susan Wild. It's a bad way to do it, and it's a highly ironic way to do it when you're telling states to go ahead and file for bankruptcy rather than get any help from the federal government. But to answer your question, I don't think it should be a grants program. That would add an additional layer of bureaucracy that I don't think is called for in this situation.
And sorry, I think we have one more quick one from the Pocono Record. Brian?
Thanks, Matt. Congressman Cartwright, what do you foresee as the biggest challenge in administering this next prospective round of aid to, say, businesses and workers in the Poconos specifically, especially in regard to the number of large and small businesses directly and indirectly related to the hospitality industry in our area, as it's been greatly impacted by the pandemic?
Sure. Really as a recognition that we haven't been through this before. You know, this is on-the-job training for all levels of government dealing with a pandemic like this. And so part of what we did, of course, was to push it off on bankers, on commercial lenders to deal with the SBA and figure out how to get immediate money into the hands of small businesses. Well, there again, the SBA, they weren't ready for it. They weren't. They handled it in different ways according to different banks, but it made it very, very difficult for people who don't have regular relationships with banks. As I said before, don't have banks on speed dial. There are a lot of unbanked business people in our country, people who don't have close relationships with bankers and maybe run businesses that don't depend on a relationship with a bank. They got nothing in the first round of SBA. You know, you're looking at 4 members of Congress here. We spent so much time on the phone dealing with small businesses who got left out of that first round of SBA money going out. Gosh, we all have 8 or 9 people working in our district offices who are on the phone constantly. In addition to ourselves, our staffs are dealing with people who couldn't get SBA money. So as a result, you know, going forward, how do we change things? Well, number one, I don't think we go back to square one. I think we have to recognize that we've all learned a lot as we go through this on-the-job training, including the bankers. The commercial lenders have a much better sense of who they have to serve, and are you know, rekindling relationships with the small business owners that bank with them. So I think that they're going to get better at it, and they think they also have a better sense for the fact that we don't want them servicing their favorite clients first, their biggest clients first. That we want everybody to be included. So I think that as with anything else, it's not a matter of pointing fingers and casting blame. It's about coming together and helping each other through the process, helping our commercial lenders, helping the SBA get the money, and including, you know, to resort properties, as you mentioned, the hospitality industry. All of that is true. Another thing that is probably worth mentioning is that there is an effort. People are looking at a bill to to force insurance companies to cover business interruption. So many small businesses, small and large businesses, have business interruption insurance policies. And the first reaction for every single carrier who wrote these policies was to deny the claim. And obviously, they're just terrified of the enormity of the liability on it. But that's something that Congress is looking at as well, is shoring up that business interruption insurance policy system in a way that makes sense. Thanks for the question.
Thank you.
Thank you guys very much. Thank you so much for doing this. Oh, I'm sorry.
Now, I know the Senate is looking at $500 billion. What are you looking at? $500 million. What are you looking at in terms of how much you want for the state and local governments?
Well, but that's the package that that I mentioned before, which we're working on in the Senate. And by the way, that's a bipartisan piece of legislation, which we'll work with Senator Cassidy and Menendez, and we're working on in the House as well. I think you have to get resources to the hotspots and to our states and localities that have been hardest hit. It's essential. Otherwise, literally, as I said, cops, firefighters, teachers, we're not going to have the resources to pay them, and we just can't. You can't run a state that way, and you certainly can't run our counties that way. So we've got to make sure, A, the resources get to the hardest hit places, and B, we get them down to our municipalities and to help them out.
Thank you.
Yeah, and really, you're asking what's the amount. I'm not going to say there is a specific dollar amount because we have to follow the guidance of experts and leave room for negotiation and all of that. But the bottom line is it has to be enough to get state and local governments the support that they need so that they're not laying off people that our citizens depend on.
Okay. All right, so we're approaching the top of the hour, so I think that's a good place to leave it. Thank you, everybody, for joining us today. We'll be following up with you shortly. For each of the regions, I think you'll have contacts in your region if you have any follow-up questions, and we'll have a recording as well available soon.
Thanks, guys.
Thank you, everybody.
Thanks, everybody. So long.